As you walk north on Park Avenue, going from 85th Street to 105th Street, there is a dramatic transition you see when you're going from the Upper East Side into East Harlem. Looking across a wide range of indices, East Harlem ranks among the least healthy neighborhoods in New York City.
Because they usually don't have that access to basic primary care, that's why the hospitalization rate for diabetes is 2.5 times higher than the rest of the city. That's why the hospitalization rate for asthma is 3 times higher than the rest of the city. And by providing access to care for the East Harlem population, we're really hoping to take those numbers down.
Nice and hot. Nice and saucy. Only in Harlem. EHHOP in the context of Mount Sinai is really this sort of global effort on the entire institution's part to really reach out to the underserved.
It's a student-driven, student-led organization that attempts to provide some type of equity in a system that's really flawed. The steering committee is composed entirely of students and is really responsible for maintaining the programs that EHHOP has and developing new programs. The really wonderful things about the way that EHHOP is organized is that we have 2 physicians who give us a tremendous amount of support, both in terms of helping improve the relationship that the clinic has with the larger Mount Sinai institution, and also in terms of giving guidance when the student group needs it.
One of the things that medical students often don't experience when they're in a traditional medical arena is that they don't experience the necessity of sort of this collaborative effort in delivering care. That, you know, it isn't just about the physicians, or you know, it isn't just about physicians working with nurses. It's physicians working with nurses, working with social workers, working with people in the community, like to be able to deliver the best care.
The patients are the ground, you know, they're what we sort of built the house on. Their needs and what they voice to be concerns for them. And then on top of that, we have all the students, I think, who work together, whatever stage that they're in, they each have something to offer. The second years basically run the clinic because they have the free time and the experience in the institution. The third and fourth years help out with any way that they can through their clinical knowledge. The fourth years more so as teaching seniors. And of course, the first years get the fun job of reminding all the logistics and doing the labs work and all the sort of administrative work that is really pivotal on clinic days. We have a patient who came in for regular health care, and in the course of one of her visits and the workup that came out of that visit, it was discovered that she had an acoustic neuroma.
Yo vine el año 2005 porque yo tenía un dolor en el oído y entonces yo vine aquí por primera vez y fue que me ingresaron al hospital Monte Sinai, donde me detectaron que tenía yo un tumor en el lado derecho, al lado del cerebro.
So we decided we'd contact one of our neurologists, and he said, sure, bring her in, I'll see her as soon as possible. We got her an MRI the same day. We
not only make sure that if someone needs a specific referral, you know, they have a specific skin condition, a specific eye condition, something like that, we make sure they get the care they need and they get it at a very affordable, if not free, price.
So we called the head of neurosurgery, and he initially said, I've got a book schedule, and then he said, I'm going to make time. And so this was a 6 to 8 hour surgery that he made time for the following day.
De aquí me bajaron al hospital Monte Sinai y ahí me internaron para sacarme el tumor. Pero sí recibí muy buenas atenciones de todos los estudiantes que me atendieron.
Our students went there every day to see her, and now she's followed by the neurosurgery clinic as well as us for free. Basically she's able to hear again, she's able to move her face again, which she had lost, and she's able to work again. What I was so impressed by is that it really was this joint effort by a lot of people. We were all able to come together, and my students had really led the baton. Like, they really had every step of the way. They talked to every consultant. They made sure that this person got the best care.
La verdad significa mucho para mí, porque sin ellos yo no sé cómo hubiera hecho para mi operación.
People are breaking down to tears and just saying that, you know, I've gone through every single possible means to get care, and I've been rejected every single step of the way. And this is the one time where people actually treated me in a professional, respectful manner, and it actually made me feel like a person.
EHHOP has made me think of, you know, a broader picture that, you know, it's not such a linear line for me to go from medical school to academic medicine down the road. Like, I really should start thinking of the equity of healthcare.
The other things that they get from a clinic like this is that they understand the barriers in so much more of a palpable way.
Yeah, I came into medical school as an MD PhD student. I thought I would learn medicine and do research and take care of patients, but it really has made me into a patient advocate that I had never really thought of before.
You don't get that education in medical school about actually dealing with patients who don't have insurance, and obviously this is such a major problem with something like 47 million uninsured. This is not something that you might encounter in your career. This is something that you will encounter in your career, and this is something you're not prepared for, I think, just by medical education.
I think it goes beyond just a student organization, though. I think it goes to the level of something that is omnipresent in the community, that really offers a way not only to bridge the gap between the ivory tower of academic medicine and the community, but also to offer medical health care and to try and tackle the inequities that are present.
Alegre canto.